Hey, Vsauce, Sigil here. Health and wellness is inextricably linked to Toronto's quality of life. Poor health is an impediment of progress of a community, and physical and mental conditions adversely affect well-being. With advancements in medical technology and treatments within Toronto, it would be logical to say that the health and well-being of Torontonians is on the rise. But is it? Looking through records published by the Toronto Vital Signs Report, we see that the physical and mental health of Torontonians is actually deteriorating much faster than before. As of 2014, 15.6% of adult Torontonians reported being obese, an increase of 32.2% since 2003. Meanwhile, Torontonian self-rated mental health has decreased by 1.2 percentage points between 2003 and 2014, while stress and drug abuse rates have increased. This begs the question, why are mental and physical health conditions of Torontonians getting worse? Obesity is affecting a growing number of Torontonians and has serious ramifications. Many major health issues are tied to obesity, such as diabetes, increased likelihood of heart disease, osteoarthritis, and higher blood pressure. These issues are often thought of mainly affecting the elderly, but obesity has also taken root in Toronto's youth. In 2014, 7% of Toronto's population, 12 and over, reported that they have been diagnosed with type 1 and type 2 diabetes, which is up from 4.9% in 2003. This is largely attributed to decreases in physical activity, nutrition intake, and availability of healthy foods. As of 2014, 61.7% of Torontonians 12 and over consumed less than the recommended daily intake of fruits and vegetables, which is up from 56.3% in 2003. Leisure time spent being physically active within Toronto has increased by 0.8% since 2003. However, Toronto continues to rank underneath the national and provincial averages for exercise. A 2015 research report by Toronto Public Health mapped out healthy food access across Toronto using the Modified Food Retail Environment Index. The Modified Food Retail Environment Index represents the ratio of healthier to less healthy food retail locations within a 1 kilometer walk of each city block. Many areas within Toronto have little to no nearby supermarkets or grocery stores that offer healthy produce. Consequently, people are forced to buy fast food or travel inconvenient distances to acquire healthy produce. The ratio of less healthy to healthier food outlets is 4:1. However, in lower income areas of Toronto, the bottom 20%, the ratio between unhealthy food retail outlets to healthy food is a drastic 15:1. This poses a major threat to the health of low-income Torontonians who have little access to suitable nutrition intakes. This, however, is far from the only threat to the health and well-being of Torontonians. To provide more insight on health and wellness, I have here Dr. Dhrumil Patel, who works in the Toronto Department of Public Health and is an expert in this field.
Almost 9 in 10 Torontonians, about 88.7%, aged 12 and over, self-reported in 2014 that they are satisfied or very satisfied with life. This is lower than the national 92.2% and the provincial 91.2% average, and not much higher than a decade ago, as it was 87.8% in 2003. 7 in 10, 70.5%, said in 2014 that they are in very good or excellent mental health, but Torontonians' self-rated mental health has decreased by 1.2 percentage points between 2003 and 2014. Nonetheless, only 7.3% report fair or poor mental health. 22.8% of the population 15 years and older reported in 2014 that most days in their life were quite a bit or extremely stressful. An unfortunate coping mechanism for stress is drugs, most commonly alcohol and cannabis, which lead to turning to more serious drugs to ease the increasing tension in their life. This raises concern for drug overdose and death, purposeful or accidental. Toronto Public Health analyzed data from annual reports of the Office of the Chief Coroner for Ontario. Their findings show that deaths due to drug overdose increased dramatically by 41% in Toronto between 2004 and 2013, from 146 to 206. Deaths from opioids in particular have raised concern. Between 2009 and 2013 alone, fentanyl deaths increased 76% in Ontario. Drug overdose has become a significant public health issue. Accidental drug-induced deaths have increased by 82% between 2004 and 2014. Over time, accidental overdose has increased as a percentage of total overdose deaths, reaching 72% in 2013. 14% of the population 12 and over were heavy drinkers in 2014, an 18.6% increase since 2003, and 15.6% of the population 12 and over were smokers in 2014. Data comparing substance use within the previous year shows higher rates of use among both adults and youth who are homeless or otherwise street-involved or incarcerated. Of Toronto, students in grades 7 to 12 surveyed, 29% consumed alcohol in the past year and 13% used cannabis. Of street-involved youth surveyed, the rates were 99% and 96% respectively.
Now, what do non-government organizations do to combat these issues? For physical health, food insecurity is a big issue. As mentioned before, availability of healthy food is disproportionate to the availability of junk food. The Mobile Good Food Market is an organization whose goal is to deliver fresh produce to fast food dense areas via food truck. This unconventional food truck is made from a repurposed Wheel-Trans bus and has single-handedly traveled to 18 different low-income communities in 2015. As for mental health, organizations such as Find Help Information Services and Distress Centers provide support for emotionally vulnerable individuals, especially impressionable teens struggling through adolescence. These programs have a passion for connecting and strengthening communities, regardless of how diverse the people of those communities are. Their jobs are to intervene and take action during the darkest times of someone's life, from mental health crises to having suicidal thoughts. Although these organizations provide assistance for those suffering from extreme psychological issues, there are other organizations that offer a more hands-on and direct solution for stress and crisis in adolescence. The Parkdale Activity Recreation Center supports people struck with poverty, poor mental health, and helps to rebuild these individuals by supplementing their requirements with food and recreational activities. These organizations understand the mental pain that people need to undergo, and while the NGOs have different procedures to guide these individuals through life, their general goal is to help nurture good mental health for the community. Although non-governmental organizations are definitely combating poor health and wellness in Toronto, Toronto is also working to improve physical health of its citizens. The Toronto Public Health has aided the launch of the Diabetes Prevention Program, which is aimed at providing health education to adults who are at an increased risk of developing type 2 diabetes. The program uses peer leaders from diverse backgrounds that conduct outreach to newcomer women and seniors in the community, plan health education sessions based on TPH curriculum, facilitate peer lead, accessible health education sessions, and develop and implement additional strategies for diabetes prevention outreach. Unfortunately, while willing to support the community, they also fall short in making their presence known. Many people, particularly those in dire need for physical and mental healing, may be unaware of these organizations. The NGOs need to let these individuals know that they exist, and that they are here to help. And although programs such as the Mobile Good Food Market fill in enough roles required for a healthy community, the amount of similar programs doing the same are scarce in Toronto. More organizations should follow in the footsteps of these programs, in order to ensure every Torontonian is provided for. In essence, some NGOs need to make their presence known and increase their reach.
Overall, poor health and wellness will always exist as an issue in the physical means of obesity, diabetes, health diseases, cancer, and mental means of depression, stress, suicide, drug abuse, and many more. That does not mean that we as Torontonians should ignore this issue, but instead we should implement combating procedures through NGOs and governmental organizations to eliminate this issue as best as we can. And as always, thanks for watching!